And here on the main stage, I will call back Dr. Javier Sala from Argentina. And
Hi,
Javier
Chris.
Sala, you will be here with how we develop our people from leadership to frontline staff. So nice to have you back here, Javier.
Thank you, Chris. Thank you. It's a pleasure to be here. And it's a pleasure to introduce Hein from Kaiser Permanente from Redwood, California. Hein is actually the Director of Strategic Initiatives from the organization, and he's going to share with us this very interesting topic. And I'm looking forward to listening to you, Hein. So go ahead, take the stage. It's all yours.
Awesome. Thank you so much for that introduction. And I really appreciate to get the opportunity to talk with all of you today. So in the next 20 or 30 minutes or so, I would like to talk with you about the culture that we're trying to create in Kaiser Permanente, Redwood City, a culture of many people solving many problems. But before I start sharing about our journey and what we've done to continue to develop our leaders as well as our frontline staff, I want to spend a little bit of time on what type of company we are, because I realize that not everybody on the call in this conference is aware of what Kaiser Permanente is and does. So, Kaiser Permanente is a health maintenance organization, or an HMO. And for us, that means that we have prepaying members that pay a monthly fee so that they can enjoy their healthcare benefits and services with our company, whether that is with their primary care physician, with their specialists, or in our hospitals. And I'm going to throw a little bit of data at you. Kaiser Permanente, we have about 12 million of those prepaying members. And as a company, we are represented in 8 out of the American states that you see here. If my presentation works well, and I think it does, that's awesome. So we're represented in 8 of the 50 American states. We have a total of about 337 facilities, and of those facilities, we have 39 hospitals. Kaiser Permanente Redwood City is in California, and in Northern California specifically. So you see that here in orange, which is my favorite color. And for those football or soccer fans amongst you, I thought I'd better make you get used to this color rather sooner than later, as you're going to see this color a lot in this month and next month, particularly on shirts of a winning team. And if we zoom in a little bit further, Redwood City, marked here in the red dot, is about 20 or 30 miles south of San Francisco. And out of those 12 million members that I talked about just a second ago, there are about 133,000 that receive and enjoy their healthcare services in our facility. So Redwood City, we are just a really tiny little speck on the overall map of the coverage that our company provides. So what I want to talk about today is about our journey as Kaiser Permanente Redwood City of creating a culture of many people solving many problems. And I would like to do that by taking a page out of Dolly Parton's book. I'm a big fan of Dolly Parton. How can you not be, right? Dolly has had a very long career in the entertainment industry, over 60 years already. And when Dolly is asked about whether she has any advice for anybody that's thinking about embarking on a journey in the entertainment industry, or anybody that has been in the industry a little bit less long, her answer is the same, and the same always. And her answer is, I don't have any advice. All I have is stories to tell. So I'm going to take a page out of Dolly's book and share a story with you, and hopefully not provide any advice. And here's the reason why. We, as a company, we have made lots of errors along the way. Nothing is perfect. We've had some wins, and we certainly had a number of losses. And that is not necessarily bad, right? It's really good for learning to have failures. And thank God we have science on our side. If you're interested in learning more about how we as human beings learn, one of the podcasts I really like to listen to are by a neurobiologist. His name is Andrew Huberman, and he's a tenured professor at the School of Medicine really nearby. Maybe a podcast you want to check out. But the point here is, since we had so many failures along the way, it would be really bad advice to take our advice. So here's our story about the culture that we're trying to create. And if we're talking about organizational culture, and if we believe that it is made and created by the people in it, the habits and actions of the people in the organization. In other words, without people, an organization would not have a culture. And that the people that have the biggest influence on this culture, an influence that sometimes lasts years, even sometimes transcends generations, the people that put the biggest stamp on this culture are its leaders. And I would therefore be amiss not to create the backdrop to our culture by introducing you to two of our former leaders. Two gentlemen that saw problems differently and came up with different solutions. And those two gentlemen are our founding fathers, Sidney Garfield and Henry Kaiser. Sidney Garfield, who was the first in the United States to set up a hospital with prepaying members, which is a model that we still use today. And it's one of our foundations. And as a result, he really became a pioneer in the preventative health in the United States. And then we have Henry Kaiser, an industrialist who in his lifetime took on many projects, but the project I want to call out here is the shipbuilding during World War II that he did, right here at the docks, only a couple of miles away from me, in which he used tools and techniques and thinking that we are talking about today in this conference, tools and techniques that we later had to relearn again through Toyota. And by applying these, he was able to build ships much faster than anybody else did. Instead of building a ship up from the keel in 230 days, which was common in those days, he built ships in 45 days, much faster. So with that backdrop, let me tell you about our continuous improvement story that started back in 2014. And it really started with one of our physician leaders, Dr. Mike, who oversaw the operating room or the OR and realized that he was facing an efficiency problem. A problem that his predecessor before him had, and a problem that if he didn't figure out a way to look at it differently and would come up with a different solution, it would be the same problem that his successor would be cutting his or her teeth on. So he started reading and he started looking outside of his own discipline, looking for ways to solve a problem in a different way. And I repeat that purposely. And as he was exploring different ways, he was one day sitting on his couch and saw a documentary on TV. These were the old days, you know. Anyways, he was sitting on his couch watching TV about a company that almost went bankrupt and was forced to do something different. And this company, by doing so, managed to save their business through the crisis and eventually became the industry leaders through cultivating a culture of problem solvers through continuous improvement. Well, as you probably know by now, and as you recognize this, that was Toyota. So he became very intrigued and curious and thought, well, maybe this is a company that can help me, and maybe this is the company that can help me look at my problem differently so that we can come up with different solutions. So he started reaching out to Toyota, and he kept calling, and he kept calling, and he kept being turned down, and he kept being turned down. But he was persistent. Toyota at some point must have gotten really sick and tired of this Dr. Mike that kept calling them. But again, he kept calling and hoping to connect with the right person at Toyota. And in the end, they agreed to come out to our facility 3 days per month and help set up a model line for the operating room. And they did that for about 4 months. And that was really our first try at using these tools and techniques. And the people that were involved were very, very excited about learning new tools and techniques. And at the same time, and very quickly, the team also realized that it was not just about the tools and the techniques. It was even more so about the mindset. It was even more so about how they led their teams and how they empower their teams to come up with ideas, how they empowered their teams to be curious, to try something new, try different solutions than the ones that had been tried in the past. And last but not least, empower them and let them know that it was okay to try something that failed. So while the team was able to create some improvement in the throughput of the OR, they were not major. And on top of that, it wasn't sustainable because of the constant changeover of the leadership of that operating room. However, that was the first model line that we created, and it created some energy, some curiosity, and some interest. So the team used that energy to look for a spot to create a second model line, which was set up with our primary care department at one of our satellite locations. And they tried that for about 6 months. And again, they saw some incremental improvement in the exam room changeover, but more importantly, people got interested. People got curious, and it changed how people looked at their work. They created a questioning attitude, and it certainly changed some mindsets. People started to allow themselves to imagine what could be possible and think about things that they had never done before. It definitely changed the mindset and shifted the culture for the better. However, ultimately at the bottom line, right, we failed with those two model lines because we didn't fundamentally change how we led in the medical center. It didn't change the leadership system. So continuous improvement in these model lines were identified and viewed by many as those unique continuous improvement projects. It didn't change how we tackled the real important challenges that our facility was facing. So while these continuous improvement projects were viewed as something that was different, it was definitely viewed as something that others did. We, in our everyday life, don't do that. And it was seen as an add-on to the work that folks did and needed to do each and every day. However, this curiosity, this energy, and this different mindset that was created went together, luckily for us, with a physician leadership change at our overall facility. While she didn't know much about CI, she was curious and found like-minded partners in the administrative and hospital leadership. They realized that as we as a facility had very, very challenging times ahead, and if we could figure out a way of leading a culture rooted in the power of collective wisdom of everyone in Redwood City, we would have a fighting chance. So rather than continuing with this kind of inch-wide, mile-deep approach with the two model lines that we had tried to set up, we wanted to spread the mindset, and we wanted to spread much, much faster than we did before. And remember, rather than creating a SWAT team of expert problem solvers, what we wanted to do is create a culture where all of our people are going to be problem solvers. So in order to do that and to help us spread this to as many people in our facility as possible, we brought in a third-party consultancy firm. And we really threw the kitchen sink at it. So we kicked off several value streams, and with it, many resulting rapid improvement events or Kaizen events. And rather than creating a value stream around a particular customer or patient need or ailment, we chose to create several value streams with a particular department at its center. So we set up value streams with pediatrics in the middle, a value stream with general surgery in the middle, a value stream with neurology in the middle. And with that came a bunch of work. We also introduced daily management systems and worked with departments on how to do that, as well as at some point in time, we didn't do everything at the same time. We introduced tiered huddles and enterprise huddles. We had formal learning classes where we put leadership through classes to learn specific tools and techniques such as A3 and other things, as well as more overall encompassing week-long courses around training within industry in the spirit of Henry Kaiser, right? We did leadership coaching and rounded together with our leaders. We learned together with them and helped them to ask the right questions as they rounded and attended daily huddles. And that's not all. We did study trips. For example, we went to US Synthetic, a company that makes drill bits for oil and gas exploration, and started on their continuous improvement journey about a decade before we did. We went to other healthcare companies such as Intermountain Health, and we also went to other Kaiser Permanente facilities that started their journey around the same time as we did, so that we could learn from one another, just like we do here today in this conference. And while we did all of that, we were just not sure whether we were accomplishing what we had set out to do, changing people's mindset. And then the pandemic hit. Value streams got put on hold. No more classes, no more study trips. And we wondered, did we just lose 6 years of momentum? If there was ever a time to keep a system in place, that time was now. And so during the pandemic, we had to solve problems we had never solved before and come up with solutions that we had never tried or done before. And here's how we did. Just like so many other healthcare organizations, we had to set up a vaccination program. And our facility vaccinated relatively more people in a shorter amount of time than any other facility in our system. We vaccinated 90,000 residents in 6 months, or in other words, about 86% of our eligible members. That was pretty good news, pretty good news. And then we had to transition from in-person to virtual care, where we had 8% of virtual visits before the pandemic. We turned that around in 6 weeks. That was up to 45% of all visits, faster and more than any other facility in our system. So the proof was in the pudding, and the pudding was pretty good. When push came to shove, the default mindset was the one of curiosity, the one of trying something new. We like that. So while we saw this mindset really stick, and as the pandemic started to appear in the rearview mirror, there were a couple of things that we really needed to think about.
Hein,
Yes.
I have a question for you. Do you have other slides, or are you all sharing our story? And is that is just the slide that you want to share?
I will tell the story, and then I will come back with a couple of slides in the end. Thanks for
That's
that question.
excellent. That's excellent, because the audience were concerned. So thank you. Please keep.
So while we saw that mindset stuck, and as the pandemic started to appear in the rearview mirror, there were a couple of things that we really needed to think about. Toyota had already told us when we set up the model lines that it was really, really important to pick an area that had real business impact. And in hindsight, we probably didn't do that very well. For example, pediatrics that we picked as a value stream location was a really highly functioning department. They didn't have any problems that necessarily made it up to the visibility level of the facility, and ultimately was deemed by our leadership as the problems that really needed to be solved. So they had the bandwidth, though, and bandwidth to learn something new. And as a consequence of having that bandwidth, but not really having the problems that are the main problems of the facility, it was seen as an add-on. Continuous improvement was seen as an add-on, something that we did in addition to the daily work, right? And it was branded as continuous improvement as opposed to our daily work. We also realized that we hadn't really taught. Many people had seen various continuous improvement projects and events. Many people had done one of these events and participated in these events, but we were really relying on too much and too often on the outside help of our third party. So we really needed to work towards internalizing our continuous improvement, make it part of our everyday work, and really carve our own path. So today, we carve our own path, and we do that with 3 themes in mind. First off, we want to make sure that we create visibility and recognition for all the activities that are taking place, and to ensure that we continue to empower our teams. And as we pick the right problems, it is so much easier to create that visibility. Secondly, we want to make sure that we continue to build capability for all of our people and leaders, our leaders and frontline staff alike. And we do that through various learning sessions that we call brown bag sessions. And during these 45-minute sessions that we do, we introduce the audience to continuous improvement tools and techniques such as visual management or leader stand at work or waste or whatever have you. And we also do book clubs where we read and discuss books from either Edgar or Peter Schein or maybe John Shook or Jim Womack, who you heard speaking earlier, or anybody else out there in the continuous improvement universe and may be speaking even here at the conference today. And then last but not least, which is really, really important, giving folks the time and opportunity to practice and learn, because when people do, the learning really happens. And I think we're doing a little better these days. We've made some progress since we went forward on our own. Already in the very beginning, Toyota kept telling us to pick a problem that really mattered, but I don't think we really understood or really listened. However, since we've been on our own, we started a value stream around a problem that is not just a problem in Kaiser Permanente, Redwood City, or the United States, but in the entire world. And that's the mental health crisis. So we've started a value stream with our mental health department at its center to help solve the supply and demand mismatch at all healthcare organizations in the entire world that they are facing with their mental health services. And because this is such a complex and pervasive problem, leadership as well as frontline staff is very engaged and aligned, and consequently, it's getting plenty of airtime and visibility. And this is an example of what the value stream looked like. And now I will go to some more slides, Javier. This is what the value stream looked like after we spent a week with our mental health leadership and their partners. They came up with a slew of problems that they felt that needed to be solved. Problems that need to be solved to help the flow of our patients through their journey of care with our mental health department. They prioritized them. And the reason for me showing this, here's where they prioritize them. The reason for me showing this, because I think we're doing a little bit better. This is the list that has changed 3 times in the last year because circumstances changed, either because of direction from our state legislature or from our regional teams. However, the overarching objective stayed the same. So we are more nimble in picking our problems and making sure that we pick the biggest problem to apply these tools and techniques and invest the time on. And this seems to be working. The mental health team has made improvement in their ability to see more patients sooner. And when some of the activities had to be stopped due to a work stoppage, this team was the first to beg and plead to pick up the work again. And as soon as they could, they wanted to do that. Not only are they having results, they are really, really enjoying it. Another example is what you see here is our daily management systems. So while we shifted from in-person to virtual and in-person to virtual again a couple of times during these crazy times of the pandemic, none of the daily management systems in our facility that we initially set up prior to the pandemic actually stopped. They continued. They continued in different ways, and more importantly, it spread like wildfire through our facility, where at the end of 2018, we had 9 daily management systems set up. Today, we have 48 daily management systems set up at all various levels of maturity, and it's an ongoing process to help mature these daily management systems. So if we think about the key learnings that we've had over these 8 years of carving our path of our continuous improvement journey, there are probably 4 things that I feel is important for me to call out. First, at least for us, and it's a constant struggle, pick the areas that have the biggest problems. Pick the areas that really, really matter, and that's so hard. But if we can do that and get the necessary airtime, investment from leadership is then a given, not a maybe or something we need to work on. Second, whenever we put people together of different disciplines and of different levels of responsibilities, good things will happen. Third, we have made way more progress than we thought we did, right? Sometimes it's really good to look back to see how far we've come rather than looking up to see how far we still have to go. So optimism is important. We believe that that is really important. Believe in what's possible. So that's also why I'm so confident that on December 18th, an orange shirt will ultimately pick up that trophy and celebrate a win. And fourth, last but not least, it's ultimately the mindset and the engagement of our people to think differently, to try different things, and to be curious that perseveres. So it is with that in mind that I'm confident to say that we at Kaiser Permanente Redwood City, with a lot of hard work, blood, sweat, and tears, are creating a culture so that in 5 or 10 years, another individual in our organization will be introduced, just like I introduced Sidney Garfield, Henry Kaiser, and Dr. Mike only 20 minutes ago. And that's our story, and I'm sticking with it, Javier.
Thank you very much, Hein. It was a great, great story. I love the idea to bringing it back from the founders up to reality, and right now, how you're doing things these days. So it's a great, great job. Um, I actually, love many, many things. Having Toyota in the OR, it's a great thing. And what about? Can you tell us a little bit more about your book clubs? It was very interesting saying, you're going through these books, from different authors that actually are presenting, okay, through this Link Global Connection meeting. So, how do you work that? Who participates in that? How do you coordinate that?
So these are book clubs that we do either monthly or bi-monthly, and it's really to continue to create curiosity, to see things differently. And it may be the participation is free, it's not mandatory, it's open to everybody. So we have physicians, we have management, we have frontline staff that join those folks that have the curiosity and have the willingness to learn something new. And as we discuss it, and maybe we see each other's different viewpoints as we read the books, hopefully that goes back to the rest of the organization and creates a little buzz. It's really important to keep that energy of curiosity and learning something new, to keep that going into our organization. Because when push comes to shove and we really need to do something different, it is that energy that really, really makes a difference.
That's great. That's great. And I have a question that might be, interesting also to the audience. We all have heard, how tough it has been, the pandemic. Okay, and you actually mentioned, how tough it was in many projects that you were having, in place. So, what about rotations and people living healthcare? Maybe did that happen to you in your organization? What can you tell us about that? How challenging that has been for you?
Yeah, I would even say it hasn't. I wouldn't even say has been, because it's ongoing, right?
Yeah.
And I think because of that, it creates an additional challenge. But that's also why it's so important that we keep this energy going, that we constantly talk about this, that we use the tools and techniques and teach each other and learn from one another. Because of the constant turnover, it's really hard to keep learnings in place that were maybe common good 4 years ago. But with the constant turnover, that goes away. So to keep that in place, book clubs, things like this, brown bag sessions, doing constant learning in improvement events is something that we use to constantly elevate that and help keep this movement going.
Thank you, Hein. Thank you for sharing. Thank you, and congratulations to Kaiser Permanente Redwood, California. We're on time, so Chris is back in the ship. So, Chris, it's all yours. Thank you, Hein.
Thank
Bye
you.
bye.
Thank you. Thank you, guys. Perfect.